Hi, I'm Lasris, one of the founding partners of the Florida Health Law Center. In this video series, we're going to discuss the licensing of a healthcare clinic under Florida law. If you're opening a healthcare clinic in Florida, there are a few things you may want to know before you get started. First, what is a healthcare clinic? Well, the law defines a healthcare clinic as an entity that provides healthcare services to individuals and tenders charges for reimbursement for such services to insurance companies and other payers. Now, the key term is reimbursement. This term refers to that payment from a third-party payer, such as Medicare or a commercial insurance company or an HMO. It does not refer to payments made by private individuals. So, in other words, reimbursement refers to the payment by an insurance company to the provider for services rendered to the provider's patient. It does not include payments from the patient directly. So if you only receive cash payment from patients and do not bill or collect from third-party payers, you do not meet the definition in the statute of a healthcare clinic and do not need to be licensed as such. But if you do receive reimbursements from third-party payers and do not qualify for an exemption from the licensing requirement, you need a healthcare clinic license. So who's exempt from licensure? A clinic may be exempt from the licensure requirement if it's wholly owned by a physician or certain other licensed healthcare providers. For example, physical therapists, hospital nursing homes, and dialysis centers. A medical practice owned by one or more physicians is exempt from the licensure requirement. A physician may even own his medical practice together with his spouse and other members of his immediate family and still qualify for the exemption. A solo practitioner who owns his or her practice together with a spouse or other members of the immediate family should be aware that if the solo practitioner dies, leaving the medical practice in the ownership of the surviving spouse or family member, that medical practice, by operation of law, becomes a healthcare clinic, subject to licensure. In that event, you should apply for a healthcare clinic license immediately. Each location is licensed separately, regardless of whether the clinic is operated under the same business name or management as another clinic. For example, a chain of 3 healthcare clinics under common ownership must have 3 healthcare clinic licenses, regardless of their proximity to each other. Healthcare clinics must either have a medical or clinic director, depending upon the services it performs. For example, if the clinic will be providing medical services, the clinic must have a physician who can serve as its medical director. But if the clinic was established to provide physical therapy services, the clinic must have a clinic director, licensed to perform or supervise the physical therapy services rendered at the clinic. Well, that's all for now. In part 2 of our healthcare clinic series, we'll talk about the requirements for applying for a healthcare clinic license. In the meantime, if you have any questions or require assistance in the formation of your own healthcare clinic, call the number at the bottom of the screen. Thank you.